Today, we are covering the critical differences between indemnity plans and managed care plans for your health insurance exam. The test will expect you to know exactly how these two models contrast in terms of provider choice, cost, and how claims are paid. Indemnity plans are also known as fee-for-service plans. This is the traditional model of insurance, where the insured has maximum freedom of choice. They can see any doctor, visit any hospital, and seek care from any specialist without needing a referral. For the exam, you must associate indemnity plans with the reimbursement model. The insured person pays for the services up front and then submits a claim to the insurance company. The insurer then reimburses the insured for a percentage of the usual, customary, and reasonable charges for that service. An exam question might describe a patient paying their doctor's bill directly and then sending a claim form to their insurer. This scenario is describing an indemnity plan. Now, let's contrast this with managed care plans. The entire goal of managed care is to control healthcare costs. It achieves this by contracting with a network of providers to offer services at a lower, pre-negotiated rate. The three main types of managed care plans you'll be tested on are HMOs, PPOs, and POS plans. Health maintenance organizations, or HMOs, are typically the most restrictive. A key feature tested on the exam is the role of the primary care physician, or PCP, as a gatekeeper. In an HMO, you must see your PCP first to get a referral before you can see a specialist. With very few exceptions, like true emergencies, there is no coverage for care received outside of the HMO's network. Preferred provider organizations, or PPOs, offer more flexibility. While they still have a network of preferred providers to keep costs down, members can choose to see providers outside of the network. A common exam trap is to confuse this with an indemnity plan. The key difference is that while a PPO member can go out of network, they will face higher out-of-pocket costs, such as a higher deductible and lower reimbursement percentage. Unlike an HMO, a PPO does not require you to have a PCP or get referrals to see specialists. The exam will test this trade-off. Indemnity plans offer the most choice, but can lead to higher potential costs and paperwork. Managed care plans limit choice and require members to use a network, but this results in lower premiums and out-of-pocket expenses. Here's a phrase to help you remember the core difference. Indemnity lets me roam, but managed care keeps costs at home. This links the freedom of indemnity plans with the cost-containment focus of managed care networks. Be prepared for scenario-based questions that describe a patient's actions. If the question mentions a network, a PCP, or a referral, your answer will be a type of managed care plan. If it emphasizes freedom of choice and reimbursement, it's an indemnity plan. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.